we have such an honor of some amazing guests, and of course, the first Abantu Voices that is actually that I will have a special reminder. Honestly, who actually didn't come to Africa Day last week? We had the most amazing time, and Lorenzo, we launched Abantu Voices, and you guys missed it, but it's okay, because our CG said we're going to make Africa Day as a monthly Africa Day. Right, CG?
Yeah.
So, again, just want to welcome, and I want to give this big welcome to my good friend, Lorenzo, who basically said, I wanted to do something amazing in Hong Kong. And already, the moment she mentioned this initiative, I said, girl, you've got it. So, with this big initiative she's talking about, let's give this big welcome to Lorenzo.
Thank you so much, Charlene. I've been waiting for this day. Good evening, everybody. Abantu Voices is live as of now, right? Yeah. We're so excited. I'm very excited to be here with you. I just also want to just take a moment of appreciation to each and every one of you who have come out in the rain and coming to join us for our debut of the Fireside Chats, where we're elevating and amplifying the voices of Africans, of women, of men, of children. I really have a feeling we'll have a child on this seat one day who will tell us about their experience and what they have had to, go through as an African living in Hong Kong. So, yes, thank you, Noel. Thank you so much, Noel. So, just a brief introduction. Many of you here do know me, but it's really what Charlene touched on around why we are doing this. Abantu Voices is a movement. It's a platform where we are going to be amplifying, and not just that, celebrating who we are, what we're capable of, and what we would like to achieve and see while we are in Hong Kong. It has been 10 months since I've been here. And someone called me a newbie, and I agree, I am a newbie, but you know what? You don't have to be, here for 10 years to make a change, even if it means a little one. With that said, I just want to start this fireside chat before I introduce my two amazing guests by, talking about the essence of Abantu Voices. Abantu is people in isiZulu, a language that I speak in South Africa. And it really talks to the ethos of why we are doing this. This is a people-centered movement. It's about the people, it's about our stories. I'm a storyteller, I am a journalist, and I'm a mom. The most difficult job, by the way. And it was through my navigating the city that I realized that there was something missing. Our voices were missing. That is why I'm on a mission to amplify those voices, whether it be in the boardroom, on stage, in the science lab, on the dentist chair, in the diplomatic corridors. I want those voices to be heard, and I want us to celebrate Africans, because what we do when we do that, we can bridge the gap and the divide that exists. We can change the narratives that exist, and we can definitely help people have a better understanding of who we are, what we're about, and what we're capable of doing. So I also just want to talk about what trailblazers and disruptors and mavericks means, because somebody asked me that, like, oh, we don't know who these people are. Well, let me tell you, trailblazers say that they're the people that forge new paths, right? They pioneer new ideas, and we do that in our offices, where we are, in our homes, we forge new paths, right? I'm trying to forge a new path for my son to eat his food. But we also get disruptors. Disruptors are people who challenge the status quo, and they introduce innovation and they introduce solutions to where we encounter problems, right? And we also talk about mavericks. These are the people that break away from the norm. They're actually one of my favorite people, right? They don't play by the rules. They're those stubborn guys that are like, nah, I know you guys are all going left, but I think I'm gonna go right. And they find their calling, they find their journey, and those are the people that I hope that I'm going to find in Hong Kong. And by the way, they're not special, they don't do anything that we don't do. They are here with us, and you have your own trailblazing, your own disrupting, and your own maverick in you. And it's just about us recognizing that. So with that, I really want to first introduce my first guest. Not only is she gorgeous and tall, but she is a formidable force in the dentistry industry. Dr. Grillon, Marlene Grillon, please can you join us on stage? So thank you. And we are in my favorite color, black, obviously. But I just want to, I do have some preparation. A journalist who doesn't prepare is a terrible journalist. But it's just for me to just keep track, because I can go on and talk to you the whole evening, and I don't want to do that. But maybe what we should do is just start by, telling us about who you are, Marlene, or Dr. Grillon. I believe it started at the age of 10 years old, where you just knew that this is what you wanted to do. And what is it that you do exactly?
So first of all, thank you so much for all coming tonight. It's such a beautiful evening, and it's just amazing. So I'm very grateful to be here. My name is Dr. Marlene Grillon, and I'm a dentist here in Hong Kong. I'm a dentist, I'm a wife, I'm a mom, we all have many different labels. And so my story is basically I'm from Switzerland, and when I was 10 years old, really from the earliest that I can remember, I knew that I wanted to be a dentist. And at that time, you can imagine when you're 10 years old, most of the people, they were at school, they were wondering, oh, really? But what was amazing is that from the very beginning, I had a really supportive family. So I don't come from a family of doctor or dentist, not at all. And so I was really the weird child who wants to be a dentist, but it was so clear for me. I had this one goal, and I knew that no matter what, I'm gonna achieve my goal. So this was very clear. I was pretty stubborn for that, and I knew that if it means that I would have to literally, which this is what I did, spend my 20s studying and spend hours reading, studying, that was just my goal, and I was about to achieve that. So yeah.
Wonderful. And one thing though is that when we do achieve what we do achieve as adults, it all started when we were kids, right? So somebody must have planted a seed in you that said, girl, you can do it. It's crazy, but you can do it. Who was that person for you?
So I'm very lucky to have such a wonderful, a very inspiring mom. So I think a lot of, everything starts a lot with our mothers. And my mom, she's not only very kind, very supportive, but also she's, a strong woman that really, from a very young age, told me you can do anything, literally, sky is the limit. And this really has been very, very important to me. It's really bring me a lot of confidence. And through her support, I knew that, okay, maybe I don't come from a family of, doctor or dentist, but I'm gonna achieve the same goal, so yeah.
Wonderful. And I believe that your mom is of Cameroon origin.
Exactly. My mom is from Cameroon, yeah.
Did she ever maybe mention about what she had learned as a child growing up in Cameroon that she maybe took to Switzerland and instilled in you and the people around her?
So what she taught me is that she is a very hardworking person. So I would say I always see my mom as this beautiful, strong woman, and this for me it's really ingrained in me. And I knew that if you want to achieve something, you need to work for it, but you will make it.
Yeah. Well, we also have someone from Cameroon. My friend here, she also is from the same country. But then, doctor, so at 10 years old, you obviously just know what you want. You're also quite an overachiever, and I'm saying it in the most positive way here, because you're one of the youngest doctors in Switzerland.
Yeah.
Tell me about that.
Because I knew from a very young age where I wanted to be, who I wanted to be, and so I understood really quickly that it will mean that I will need to sacrifice also a lot, as I mentioned before. And so I started university really young, and I I was very focused, on my goal, and I have a very scientific mind, so I know that to achieve A, I need to do this plus this to achieve that, and then I became a dentist really young, and in a way, in this industry, as you can imagine, I'm coming from a small town in Switzerland. Nobody was looking like me, obviously. At university as well, nobody was looking like me. But for me, that was never, it was never an issue, or because I was so fixated on, it was more noise. I was thinking, okay, nobody's looking like me, doesn't matter, I'm gonna just achieve what I have to achieve. And that was pretty clear for me.
But then you moved to Hong Kong in 2019, right? And then you get to a place where no one still looks like you.
Exactly.
So how did you take that?
It has been a bit the story of my life, but in a way, I never intended to blend, because for me, actually, I still consider that as my biggest strength, because at least people remember you and you can bring something different. So don't think that, because you don't look like everybody else, it will be a disadvantage. Actually, that's your biggest strength. That's how I really always see myself. And here in Hong Kong as well, I actually, for a foreign medical professional here in Hong Kong, it's very difficult. I had to relicense. Everybody told me, do not even try. You will never manage. Nobody managed. But again, the stubborn me thought, okay, I'm gonna show you. And eventually I then became the first ever Swiss dentist licensed here in Hong Kong. And thank you. And then you need to imagine that I entered this industry, especially here, that is very, I would say, very competitive, very strict. But again, for me, it doesn't really matter. I'm here, I'm bringing my touch, my specific, touch, and I know that I'm bringing something different, and I'm actually very proud of that, very proud of my heritage, very proud of what I can bring. So my message is just that I think it's important to observe the environment, but we don't necessarily need to blend or to try to look or do exactly like the other.
I love that. You say that your superpower basically is actually you looking very different. But the one thing that I've noticed, especially when people go and visit you, doctor, is that they come out with a very positive experience. I mean, who here remembers their first dental visit, right? That's so positive, right? But what really comes across is that you have this very calm, patient-focused approach, and this is the point that I want to emphasize, right? Like this pain-free and gentle environment. I mean, are these some of the sort of like ethos or some of the I guess what you strive for when somebody visits you and you make sure that they don't leave with that sort of experience?
Because I think my biggest motivation and the thing that I love so much, and I think that's what really drives me when I was so young. I love to actually help people, take care of people. And I feel I have this kind of superpower that when somebody comes and they are in so much pain, there is nothing that makes me more happy than 1 hour later, I was able to help them. And then they leave and they're good. And for me, at the end of the day, that's the biggest, satisfaction. It's really fulfill me. And I generally love, helping others. And I think that's really why I did this profession, and it brings me a lot of joy.
And maybe just to bring everyone on board in terms of your background, your bachelor's, your master's, and your doctoral degrees, where you got them at the University of Geneva, the dental medicine degrees, that is. But over and above that, you've dabbled in teaching, researching. They've even published some of your work in leading dental journals. Tell us about the experience of having to leave, that sort of comfort zone of being really good at what you're doing in that country, and then coming here. Tell us about that sort of transition, and what can we learn from people that do the same thing?
So actually, the transition is when I moved to Hong Kong. As I mentioned, I could not practice. So then I started to work at the university, at Hong Kong University. And at the university, I was teaching the student. So basically it was a bit of a funny situation because, okay, I'm teaching the student, but still I need to do this exam. But it was amazing because it really reminded me that you need to be very humble, and I actually learned so much through, like putting all of your ego aside, everything that you have achieved in the past aside, and you relearn. And actually this experience, like I learned so much, and it was beautiful in Hong Kong. It was a completely different culture, completely different approach, and it was really brilliant. So for me, it was really like, my whole life it was about, okay, you put your ego aside and you learn again. And a thing that I've always tried to always do is to surround myself with people that were actually better than me, because this is how you really learn. I always trying to be, I don't like to be the smartest in the room, because I love to really like learn, because we can learn so much from the people around us, and especially here in Hong Kong there's so many interesting people in their specific field. And
while you did have that experience, I'm sure there were some hurdles, and how were they crossed over?
I would say the rigidity. I could feel in Hong Kong it was really rigid, in a sense there is a rule and you need to follow this rule. And there is no way around. I think we have all experienced that. It's very rigid, very hierarchy. And in medicine especially, it's really, you can feel really this rigidity. And so, I had to navigate, and I had to, again, a lot of work, a lot of sacrifices, but eventually it does pay off.
And then you break through, doctor. You break through, you now have a practice. And as I've said, judging by what people are posting on the socials, people are really having a pleasant time in your presence. And with that, how do you find the reception in Hong Kong? How are people finding you when they come into your room and they realize, oh, okay, this is different? What's the sort of reception that you receive?
So in Hong Kong, I would say that the response has been really amazing, because people really appreciate when you can deliver something that is different, and people appreciate when you really take care of them. For me, like my patient, they're really at the center, and I love to make people feel, good, and people feel confident, and especially, you need to imagine most of the people, they arrive, they're extremely scared, and sometimes they had a lot of traumas, and for me, my greatest joy is to really empower them and make them feel confident, make them feel good, and then bring my expertise at the service of others. And this is my greatest joy.
Yeah. It's really amazing how time is flying. I can't believe we've been talking for almost 30 minutes. But I really want to talk about, the representation. As a woman of color, as a black woman, how important is it that somebody sees a person that looks like them doing what you do? What's your feeling and your take on that?
So especially in Hong Kong, I could feel that my patient, like from this community, when they see me, they feel really great, because they feel, oh, somebody is looking like me, and somebody can understand me. But I would say that for me, as my whole journey, I never really, the representation was not really a thing, because nobody was looking like me. And even here in Hong Kong, my colleagues, nobody's really looking like me. And so it's not really something that I'm thinking about, or that I'm suffering from. But I always keep in mind, I hope one day I will be able to inspire, a young girl that will think, so it's kind of creating a path. Sometimes it can be a bit frustrating, because sometimes it's a bit of a lonely journey, but hopefully I have an amazing also support system. My family is very, my friends, my family, they're very supportive, my husband, and but I'm not really thinking about finding people similar to me in my industry, because I know that's not the case, and it has never really been the case.
But I think it could stop being the case, because we now see that it's possible with you, doctor. And that's why it's so important to hear you and talk about your very pleasant experience. But before I wrap it up, I want you to just touch on, you also, spend some of your time servicing underserviced communities in Hong Kong and around, not just in Hong Kong, right? Can you just tell us more about that?
So as I said, for me, my greatest satisfaction, my greatest joy is really to help people, and especially underserved community, women a lot. And so I've been doing some mission in the Philippines, for example, where I focus really about kids, because really for me, you know, like minorities or people in needs, like this is where I enjoy the most really to kind of help. And so I've been doing like multiple missions, and it has been so amazing and so, you know, fulfilling, rewarding, and yeah, that's something that I really, really enjoy.
Thank you for putting a smile on every hole, Doctor. I really appreciate your work. I just want to open up the floor to maybe a question or two for the doctor. If anybody wants to ask anything that I could have missed. Go ahead.
Hello. My question really is about...
Maybe tell us who you are, where you're from.
Alright, my name is Raja Maine. I'm from South Africa. New to Hong Kong. I've been here for about 5 months now. And I'm a pilot for Cathay Pacific.
That's right.
My question really is about where I come from personally. Dental health was not a thing unless there was something really tragic going on in your mouth. You know, the whole go to the dentist twice a year or once a year, it was not a thing where I come from. It's still not a thing. There was a point personally in my own life where I had swollen gums for a while. Like it would take 5 days, but I'll go away like nothing happened. You know, and it happened twice a year. It's only when I started flying, when I couldn't fly because you need to speak over the radio, and I'm like, okay, this is a problem. But I dealt with it for about 6 years, and nobody goes to the dentist, man. And if it goes away, so I wonder how you, as a doctor, then try to encourage people who come from, I would say, the communities that a lot of us come from, where dentistry is just, we go to a doctor when we have to. You don't go to a doctor because, hey, let's check it out. Let's see what's going on in your mouth, you know? So I'm very curious about that. Yes, that's the question.
That's such a good question. That's such a good question. And that's, I feel my biggest mission now is to really like share the knowledge and really for people to understand that our mouth is not only our mouth, it's really connected to our whole body, and to kind of, you know, bring this importance and to really like emphasize in prevention. I'm all about preventing and not treating, but preventing. Less dentistry is the best dentistry. There is nothing that makes me more happy when I see a patient and they have nothing. They have the perfect mouth. And it generally makes me so happy because, you know, like my goal is really to make sure that people are healthy, they're good. And so, yeah, I think there is this misconception that, oh, we need to visit like a dentist when we are in pain. Unfortunately, that's too late. And the reason why is that because people are scared. And so that's why I feel it's my role to kind of bring, you know, another view of dentistry. We have sometimes this cliche of the old dentist, and so I'm really happy to kind of bring this kind of fresh and new image of dentistry, and to really like make, like, now what is really amazing is that my patients, I'm so lucky because I have the most amazing patient. I feel everybody that come to the clinic, they're just so lovely, and we basically, like, you know, cultivate this kind of relationship of trust, of really, and it's really like a pleasure. So that's really my role, I feel, to really like educate, share knowledge, and but that's a very, very important point. So thank you.
Keep on doing that, Doctor. We really are encouraged by your story. I think all of us can agree, right? Yeah. What a powerhouse you are. Thank you so much for sharing, you know, your story with us, but also just educating us about the do's and don'ts. And you mentioned one thing that I thought was a bit controversial, though, about how we should brush our teeth before we eat. Yeah.
I'm gonna make a whole video about that, because also this, I feel people really like to hear like tips, and so no worries. It's coming. It's coming. But I would say my biggest message is really a message that literally, like, nothing can stop you in any field. You're strong, you're powerful, you're beautiful. Work hard, believe in your dreams, and nobody, you know, can, no matter where it is. In Europe, in Hong Kong, in Africa, in Asia, no matter where it is, really like believe in your dreams, work hard, because obviously like nothing comes, you know, serves to us. But that's really, I hope I will bring, you know, some hope and some and some inspiration on that.
A round of applause for the doctor. Inspired or what? Well, inspired to brush my teeth too. That was great, doctor. Thank you so much. Let's go for a little comfort break, refill your drinks, and then we'll come back for our second guest.